Assalamu alaikum and hello everyone. This is the continuation of your first lecture. In the previous video, we had discussed about the osteology of the lower limb. Okay, then we had discussed the important points on anatomy of the joints and the clinical aspects. All right, then we had discussed regarding the layers of the lower limb, that is the skin, superficial fascia, deep fascia, and all that. Then we had discussed regarding the compartments of the lower limb, that is the anterior, medial, and the posterior compartment. All right. So now we'll start with anterior compartment of the thigh. So before watching this video, I would suggest you to watch the previous video so that it will be easy for you to understand. All right. So now we'll start with the anterior compartment of the thigh. Anterior compartment of thigh is also known as एक्सटेंसर कंपार्टमेंट. ठीक है. Posterior compartment of thigh is known as flexor compartment, and medial compartment of thigh is also known as adductor compartment. All right. So how to remember this? See, F, flexor compartment. If you close this F, it becomes P. So flexor posterior compartment. All right. Then अगर flexor posterior compartment है तो obviously extensors will be in the anterior compartment. The other compartment is the medial compartment, which is the adductor compartment. ठीक है. Now coming to the anterior compartment. So first we'll study the muscles of the anterior compartment of thigh. Basically, we have two muscles. One is sartorius, and the other group of muscles is called quadriceps femoris. Okay. Now, why do we call this as quadriceps femoris? Because there are four muscles in this group. Okay. What are the four muscles? Four means quadra, है ना? So, what are the four muscles in this group? The first one is biceps femoris एंड वास्टस ग्रुप्स ऑफ मसल. वास्टस में तीन है, वास्टस लेटरालिस, वास्टस मीडियालिस एंड वास्टस इंटरमीडियस. तो वास्टस ग्रुप plus biceps together they are called as quadriceps femoris, four muscles. Apart from this we have sartorius, khatam, muscles of the anterior compartment of the thigh. Now what are the important points which we need to remember regarding this? देखो, सबसे पहले sartorius muscle is very 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 important. See, you can see the sartorius muscle here. This is the longest muscle of the body. You can see here. I think it's clearly visible. This sartorius muscle, this is the longest muscle of the body. All right. Now, why do we call this muscle as sartorius? Because sartor means tailor. ठीक है. So this muscle, the role of this muscle is very chief in tailors. That is why this muscle is called as sartorius muscle or tailor's muscle. ठीक है. This muscle is the longest muscle. It is called tailor's muscle. It is also called as honeymoon muscle. Okay. This is a ribbon shaped or S shaped muscle. These are the important points which you need to remember regarding the sartorius muscle. All right. Now coming to the action. I told you, remember that it is extension. Remember the word kicking. Kicking में what we do? There is flexion of hip joint and extension of knee joint. First we flex our leg, है ना? Then we extend, है ना? So the action of these muscles is at flexion at which joint? It is flexion at hip joint and extension at knee joint. Kicking, remember, kicking. So this is the action. Okay. Next, coming to the nerve supply. Nerve supply is femoral nerve. In the previous video only I had discussed regarding this. The nerve supply to the anterior compartment of thigh is the femoral nerve. One important point which you need to remember regarding this femoral nerve is it is the largest branch of the lumbar plexus. All right. What is the root value of femoral nerve? It is L2, L3, L4. L2, L3, L4. ठीक है? What, which is the chief artery that supplies the anterior compartment of thigh? It is the femoral artery. Nerve, again, it is the femoral nerve. Sorry, nerve, I have told you femoral nerve. Vein is the, again, it is the femoral vein. So remember, muscles, anterior compartment is also called as extensor compartment. Two important muscles, sartorius and quadriceps femoris. What are the four muscles which come under quadriceps femoris? It is biceps femoris and three vastus group of muscles. ठीक है? Now sartorius, very important. Why? Because it is the longest muscle of the body. This muscle is also called as Taylor's muscle, honeymoon muscle. All right, coming to action. I told you flexion at hip joint and extension at knee joint. Remember the move, this action, kicking. ठीक है? Then nerve supply, arterial supply and venous drainage, just remember it is femoral. Femoral nerve के बारे में क्या important चीज याद रखना है? It is the largest branch of the lumbar plexus. What is the root value? L2, L3 and L4. Now I told you femoral artery supplies the anterior compartment of thigh. You can see here, this is the femoral artery. All right. Femoral artery is the branch of external iliac artery. Last class, when I had discussed about the aorta, in that class I had discussed in detail about the arterial system of the entire body. All right. तो उसमें I had discussed the aorta. See, first part is ascending aorta, arch of aorta, then descending aorta. Descending में पहले we have descending thoracic aorta, then we have descending abdominal aorta, right? Ascending aorta, arch of aorta, descending thoracic aorta, descending abdominal aorta. This descending abdominal aorta terminates into two common iliac arteries. Then this common iliac arteries gives two branches. One is external iliac artery and the other is internal iliac artery. So when this external iliac artery passes beneath the inguinal ligament, this external iliac artery only becomes the femoral artery. Alright, so femoral artery is the branch of external iliac artery. External iliac artery is the branch of common iliac artery, and common iliac artery is the terminating branch of aorta. ठीक है? Your concept should be very clear. Don't just memorize, okay? Femoral artery. Now, which is the largest branch of femoral artery? It is profunda femoris. There are many branches, but exam point of view, just remember the largest branch is the profunda femoris artery, and this artery itself supplies the all the compartments of thigh, all compartments of the thigh. The chief artery which supplies the thigh is the profunda femoris artery, which is the largest branch of femoral artery. All right. I hope it is clear. Okay. So femoral artery only when it passes either niche. In the next class, I will discuss about the popliteal fossa. When it passes in the popliteal fossa, after reaching the popliteal fossa, here it becomes the popliteal artery. ठीक है? When we discuss leg, we'll study about this popliteal artery, its clinical anatomy and all that. Okay. So in the next slide, we'll be discussing about the medial compartment of thigh. So this is the medial compartment. medial compartment. This compartment is also called as adductor compartment. This is also very, very, very important. There are two important structures which we need to learn in this compartment. One is the femoral triangle and the other is the adductor canal. Okay. Now, first we'll see about the muscles of the medial compartment. So, what are the muscles in the medial compartment? Adductor group of muscles. We have adductor group of muscles in the medial compartment. इसमें से सबसे इम्पॉर्टेंट adductor group में we have many muscles like adductor longus, adductor brevis, adductor magnus. All right. We have gracilis. Okay, we have pectineus. So these are the muscles of the medial compartment of thigh. लेकिन इसमें important क्या याद रखना है? Adductor magnus. Why? Because this is the largest muscle of this compartment. Adductor magnus is the biggest muscle. Magna means big. So adductor magnus is the biggest muscle of this adductor compartment. Okay. You can see this is the adductor magnus, है ना? तो इसी में we have an opening here. This opening is only called as adductor hiatus. ठीक है? Adductor magnus is the biggest muscle of the medial compartment of the thigh, and this muscle, adductor magnus muscle, is also called as composite muscle of the body. Okay, and this muscle is also called as hybrid muscle. Okay, now why do we call this as composite muscle and hybrid muscle? Because this muscle has dual nerve supply. Okay, so what are the two nerves that supply this muscle? They are the obturator nerve and the sciatic nerve. Sciatic nerve is basically related with the posterior compartment of thigh and obturator with the medial compartment of thigh here. So, adductor magnus is supplied both by obturator nerve and sciatic nerve. So, it receives dual nerve supply. That is why this muscle is also called as hybrid muscle and composite muscle. Okay. Do we have any other muscle in the lower limb which is also called as hybrid muscle and composite muscle? Yes, it is pectineus. This pectineus muscle is also called as hybrid and composite muscle. ठीक है? Now, coming to the action, it is adduction. The word itself here tells it is adduction. What is adduction? It is bringing towards the midline. Abduction is going away from the midline. See, for example, if you are closing your fingers, if you are bringing your fingers together, then that is adduction. If you are making them go apart, then it is abduction. है ना? So, the action is adduction. All right. Now, coming to the blood supply, it is obturator artery. Anterior compartment, femoral thana. So here we have obturator, sorry, nerve supply. It is obturator nerve. ठीक है? And blood supply, obturator artery. Okay. Now, obturator artery is the branch of internal iliac artery. See, I had told you this descending abdominal aorta divides into two common iliac arteries. which further divide into external and internal iliac artery. So femoral artery was the branch of external iliac artery, whereas remember obturator artery is a branch of internal iliac artery. ठीक है? This is the obturator foramen here. Ye- Okay. So important points in the medial compartment. Let me revise. Muscle, adductor longus, important muscle. Why? Sorry, adductor magnus, important. Why? Because it is the biggest muscle of the medial compartment of thigh. It is also called as composite muscle, hybrid muscle, because it has dual nerve supply. What are the two nerves? They are obturator and sciatic nerve. All right. Which is the other muscle which is also called as hybrid? It is pectineus. All right. So, what is the root value of obturator nerve? It is L2, L3, and L4. Obturator nerve L2, L3, and L4. ठीक है? Now, moving on to the next slide, the next compartment, which is the posterior compartment of thigh. Yes. Now, this posterior compartment is also called as flexor compartment. है ना? F, when you close, it becomes P. For posterior compartment is also called as flexor compartment. Now, posterior compartment, we will study this in two divisions. One is the gluteal region and the other is the back of the thigh. ठीक है? First, we'll study about the gluteal region. See, this is the gluteal region. All right. What are the muscles of the gluteal region? There are many muscles in the gluteal region: gluteus maximus, gluteus medius, gluteus minimus, and so on. But remember that maximus नाम में ही है ना, gluteus maximus. This is the largest muscle of the body. Okay. Longest muscle sartorius था, है ना? Largest muscle gluteus maximus है. Okay. See, this is the gluteus maximus muscle. You can see this is the largest muscle of the body. ठीक है? Next, we have gluteus medius and gluteus minimus. इसके बारे में क्या इंपॉर्टेंट चीज याद रखनी है? These muscles are used for intramuscular injections. Okay. It is not gluteus maximus. We give injections over gluteus medius and gluteus minimus. Okay. See, when you divide the gluteal region, it is divided into four compartments. This is the gluteal region. This is divided into four compartments. So this anterior superior part of the gluteal region is used for giving IM injections. Why don't we use this? Because here there are various nerves and muscles, sorry, nerves and arteries. So there is a risk of damaging these vessels. That is why this part, that is the anterior superior part of the gluteal region, is used for giving injections. All right. Next thing, when these muscles they get paralyzed, when there is paralysis of these muscles, gluteus medius and minimus, the patient will be waddling. The patient will be waddling. So it results in lurching gait and waddling gait. Okay, the patient can't walk properly. If it is unilateral, then it is lurching gait. If both the sides, if they are affected, that is, if it is bilateral, then it will result in waddling gait. All right. So coming to the nerve, it is superior and inferior gluteal nerve. Okay. Here you have a foramen which is called as, it is not visible in this picture, there is a foramen which is called as greater sciatic foramen. Okay, the sciatic nerve passes through this foramen, and sciatic nerve is the chief nerve of the posterior compartment. Apart from this, in the gluteal region, we have inferior gluteal and superior gluteal nerves and arteries. ठीक है? So there are various structures which pass through the sciatic foramen. Okay, they come into the gluteal region. So that is why this greater sciatic foramen is called as gateway gateway of gluteal region. ठीक है, this is called as gateway of gluteal region. ठीक है, तो arteries, inferior and superior gluteal arteries, and nerve, I told you chief nerve is the sciatic nerve. This nerve is the thickest nerve of the body. Previous class में I told you, and root value भी I told you, right? Sorry, it is L4, L5, S1, S2, and S3. All right, remember this. They might ask you because this is the thickest nerve of the body. Okay. So next we'll be studying the back of the thigh. This was about the gluteal region. Yes. This posterior compartment ही है ये, gluteal region cover हो गया था. Now this is the back of the thigh. इसमें important क्या क्या याद रखना है? Back of the thigh में we have four group of muscles. These muscles are called as hamstring muscles. Very important, hamstring muscles. They might ask you, okay, why do we call these muscles as hamstring muscles? Because the European butchers, they used to slaughter the pigs and hang with the help of these muscles only. String बोले तो लटकाना बोलते हैं ना, तो दे यूज टू हैंग दी मजल्स, गोश्त जो लटकाते हैं ना दुकान में, तो दीज मजल्स वेर यूज बाय द यूरोपियन बुचर्स आफ्टर स्लॉटरिंग द पिग्स. दैट इज वाई दीज मजल्स आर कॉल्ड एज हैमस्ट्रिंग मजल्स. What are the four muscles? First one is semitendinosus. Then we have semimembranosus. Then we have long head of biceps femoris, and the ischial head of adductor magnus. We have seen adductor magnus in the previous slide. All right. So see, you can see this. ये देखो ये ischial tuberosity है ना. तो the origin of all the four muscles is common. The origin here is the ischial tuberosity. है ना? See, the origin of all the four muscles. This is semimembranosus. This is semitendinosus. This is the biceps femoris, adductor magnus we had seen in the previous slide. So remember these four muscles, okay, which are called as hamstring muscles. All right. ब्लड सप्लाई, नर्व सप्लाई वही होगी. ठीक है, बैक ऑफ द थाई आई टोल्ड यू शियाटिक नर्व, and blood supply, all the compartments I told you it is femoral artery ka which branch? Profunda femoris, chief artery. There are various other arteries also, but chief artery. Okay, nerve, It is sciatic nerve. Okay. Veins. In the last slide, I'll discuss about the veins. Okay. They run along with the arteries itself. Okay. So it will be the femoral vein only. Whichever artery is there, the same accompanying veins will drain. Okay. Now moving on to the next slide. Yes, here. See, you can see here, this is the sciatic nerve. ये देखो, the posterior compartment of thigh is supplied by the sciatic nerve. Here, near the popliteal fossa, this sciatic nerve divides into two branches. Okay, this is the sciatic thickest nerve of the body, thickest and longest as well. Okay, that divides into two branches. Sciatic nerve divides into fibular nerve and common peroneal nerve. All right. I'm writing the root value again and again so that it will be easy to remember. Okay, ठीक है. Now, when there is injury to this common peroneal nerve, injury to this common peroneal nerve leads to a condition called as foot drop. Okay, upper limb में we have wrist drop, lower limb में foot drop. So, which is the nerve which is injured in wrist drop? It is radial nerve. And which nerve is involved in foot drop? It is common peroneal nerve. ठीक है. ये देखिए यहाँ पे foot drop. See the normal foot and you can see the foot drop here. All right. The nerve involved is the common peroneal nerve. Okay. The next important structure is the femoral triangle. Very, very, very important. Femoral triangle is very important. Femoral triangle में first we should know what are the boundaries of the femoral triangle, the contents of the femoral triangle, the roof of the femoral triangle, the floor of the femoral triangle. ठीक है. Now first in this slide we'll be studying the boundaries of the femoral triangle. ठीक है. See, the base of the femoral triangle is formed by the inguinal ligament. Previous first video may I have told you that inguinal ligament extends from anterior superior iliac spine till the pubic tubercle. All right, this inguinal ligament. Now, how is this inguinal ligament formed? Inguinal ligament, how is this formed? Important, it is formed by the aponeurosis of extensor oblique muscle. यहाँ पे ना abdomen में वी हैव एक्सटेंसर ऑब्लिक मसल. ओके, हियर तो इसी का फोल्डिंग जो है ना अपोन्यूरोसिस, उसी से जो है इंग्वाइनल लिगामेंट बनता है. ठीक है. तो बेस इज फॉर्म्ड बाय द इंग्वाइनल लिगामेंट. यू कैन सी द बेस है ना. इट इज फॉर्म्ड बाय द इंग्वाइनल लिगामेंट. एक मिनट. Base is formed by the inguinal ligament. This is the medial border है ना. Medial border is formed by the adductor longus muscle. Adductor longus का, adductor longus का, you can see this is the medial part of the adductor longus muscle. So medial, it is medially bounded by the medial border of adductor longus muscle. All right. This is the lateral boundary. Laterally, it is bounded by which muscle? It is sartorius muscle. Laterally. ठीक है. Laterally, it is bounded by the medial border of sartorius muscle. You can see here, this is the medial border of the sartorius muscle, all right? So laterally it is bounded by the medial border of sartorius muscle. Clear boundaries: base by inguinal ligament, medially it is bounded by the medial border of adductor longus, and laterally we have medial border of the sartorius muscle. Longest muscle है ना ये, all right? Next, coming to the roof. Roof may it is very easy. I had told you it's skin, superficial fascia, deep fascia. ये तीन हम डिस्कस किए थे ना. Deep fascia is also called as, what is it called? It is also called as fascia lata. All right. So these are the roof of the femoral triangle. Now coming to the floor of the femoral triangle. फ्लोर वैसे बहुत ज़्यादा इंपॉर्टेंट नहीं है, कंटेंट ज़्यादा इंपॉर्टेंट है, बट फिर भी आप याद रख लीजिए इट इज़ फॉर्म्ड बाय मीडियली बाय अडक्टर लॉन्गस. फ्लोर तो देखिए यहीं पे अडक्टर लॉन्गस है, यहीं पे एक मजल रहता है जिसको हम पेक्टिनियस बोलते हैं, ठीक है. दिस मजल इज कॉल्ड एज पेक्टिनियस मजल. So floor is formed medially by adductor longus and pectineus muscle. ठीक है. And laterally it is formed by psoas major and iliacus. Here we have psoas major and iliacus muscles. Okay. Psoas major and iliacus. Laterally यहाँ पे श्वास मेजर और इलियाकस है ऐसे, एंड हियर मीडियली वी हैव अडक्टर लॉन्गस एंड पेक्टिनियस मसल. पेक्टिनियस हाइब्रिड मसल था, है ना. तो दिस वाज रिगार्डिंग द फ्लोर ऑफ द फीमोरल ट्रायंगल. फ्लोर बहुत ज़्यादा इंपॉर्टेंट नहीं है, बाउंड्रीज ज़्यादा इंपॉर्टेंट है, एंड देन इसके अंदर जो कंटेंट्स है ना, दैट इज वेरी वेरी इंपॉर्टेंट. ओके. सो इन द नेक्स्ट स्लाइड विल बी डिस्कसिंग रिगार्डिंग द कंटेंट्स ऑफ द फीमोरल ट्रायंगल. ये देखिए, these are the contents of the femoral triangle. Okay. Sorry. Contents. Laterally we have femoral nerve, lateral most part. Then we have femoral artery. All right. Then we have blue colored femoral vein, है ना. Then here we have group of lymph nodes. Okay. Lymph nodes. These lymph nodes are called cloaquet nodes. Cloaquet nodes, and they are also called as nodes of Rosenmuller. Lymph nodes of Rosenmuller. Very important. Okay. These lymph nodes they drain clitoris in case of females and glans penis in case of males. ठीक है. The lymph nodes here, these are called cloaquet nodes or lymph nodes of Rosenmuller. Now, how do we remember? See, ये laterally है, ये lateral part है, ये medial part है. Laterally it is navy, Navy, navy. ये lymph node के लिए है, ये vein के लिए है, ये artery के लिए है, और ये nerve के लिए है. ठीक है. Navy. Apart from this, remember the synonym of this lymph node. This is very 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 important. Okay. Now here in the next slide we'll be learning about one more important structure, that is adductor canal. All right. This is the adductor canal. Now this canal is also called as subsartorius canal, subsartorial canal. Okay. This adductor canal is triangular shaped. You can see ऐसा है इसका शेप. ओके. ये मजल के बीच में जो है ना स्पेस है, दिस इज व्हाट इज एडक्टर कैनाल. दिस इज intermuscular space. Okay. Which is located in the middle one third of the thigh. ठीक है. This canal, because this canal is just below the sartorius muscle, that is why this canal is also called as subsartorial canal, and this canal is also called as hunter's canal. Remember the synonyms. Okay, now why do we call this canal as hunter's canal? Because there was an anatomist by name John Hunter. Okay, he was an anatomist and surgeon at London. Okay, so Hunter's operation for the treatment of popliteal aneurysm was done by him. है ना? He used to ligate the femoral artery in the adductor canal. Previous slide I told you this femoral artery जो है ये adductor canal में है. जब ये artery popliteal फोसा से पास हो जाती है तो इसी को हम पॉप्लिटियल आर्टरी बोलते हैं. तो इन केस ऑफ पॉप्लिटियल अन्यूरिज्म्स, okay, aneurysm is the dilatation of the artery. He used to ligate the femoral artery here in the adductor canal. So that is why this canal is also called as Hunter's Canal, named after John Hunter, because this was a landmark in the history of vascular surgery. ठीक है. In the next slide we'll be discussing about the veins. Here veins में three important things which you need to remember is the venous system of the lower limb is divided into superficial venous system and deep venous system. ठीक है. Apart from this we have other perforating veins as well. ठीक है. Now, the deep venous system, this follows the arterial system only. I had told you, no, say, venous system here, the posterior tibial vein, then the popliteal vein, then the femoral vein, which eventually drains into the external iliac vein. This will drain into the common iliac vein, which will drain into the inferior vena cava, which will again drain into the right ventricle. है ना? So this deep venous system, it accompanies the arterial system only. So you might have heard of deep vein thrombosis. Okay, अगर thrombosis deep vein में यहाँ पे होती है तो क्या होता है? This thrombus will travel from the popliteal vein to the femoral vein, then into the external iliac vein, ultimately into the inferior vena cava, then into the right ventricle. Right ventricle से it will enter the lungs, leading to pulmonary embolism. ओके तो समझ में आया पल्मोनरी एम्बोलिज्म कैसे थ्रोम्बस जाके कहाँ पे लॉज होता है? डीवीटी में, डीप वेन थ्रोम्बोसिस में. ओके, नेक्स्ट इज द सुपरफिशियल वीनस सिस्टम. सुपरफिशियल वीनस सिस्टम में देर आर टू इंपॉर्टेंट वेन्स. वन इज द ग्रेट सेफेनस वेन and the other is the small saphenous vein. All right. Now, why do we call these veins as saphenous? Saphenous means seen, easily seen. Saphen in Greek means easily seen. अब ये सुपरफिशियली है, सुपरफिशियल फेशिया में. ऑल राइट, सबक्यूटेनियस वेन्स हैं ये. तो इट इज इजीली सीन, दैट इज वाई इट इज कॉल्ड एज सफेनस वेन. Okay, remember that the great saphenous vein or the long saphenous vein is the longest superficial vein in the lower limb. ठीक है. अब ये लोअर लिम में यहाँ मीडियली है. यहाँ पे देखिए ये जो आर्च है ना, डॉर्सल वीनस आर्च, यहीं से ये शुरू होती है एंड इट रन्स मीडियली. ग्रेट सेफिनस वेन, इट रन्स मीडियली हियर, देन ये पोस्टीरियरली जाके अगेन इट गोज हियर इन द फ्रंट ऑफ द थाई. और ये ग्रेट सेफिनस वेन इट विल इवेंचुअली मीट द फीमोरल वेन हियर. ठीक है. Great saphenous vein will drain into femoral vein. Again, femoral vein I explained you in the external iliac vein, which will drain into common iliac vein and IVC, and therefore it will meet the deep venous system. So here we have an opening here. This opening is called saphenous opening. Okay. यहीं पे एक fossa भी है. This fossa is called as fossa ovalis. this fossa only here, this is called as fossa ovalis. तो venous system समझ में आया. Apart from this great saphenous vein, we also have small saphenous vein here. Okay, this vein runs laterally. Small saphenous vein will drain into which vein? It will drain into popliteal vein. ठीक है. Great saphenous vein drains into femoral vein, and small saphenous vein they drain into the popliteal vein here. ठीक है. इसके अलावा वी हैव फ्यू परफोरेटिंग वेन्स विच कनेक्ट द सुपरफिशियल वेन विद द डीप वेनस सिस्टम. सुपरफिशियल वेन है और डीप वेनस सिस्टम, इन दोनों के बीच में वी हैव कम्युनिकेटिंग वेन्स विच आर कॉल्ड एज परफोरेटिंग वेन्स. ओके, ठीक है. देखिए ऑब्वियसली डीप वेनस सिस्टम में जो है प्रेशर ज़्यादा होगा सुपरफिशियल वीनस सिस्टम से, है ना. तो सुपरफिशियल सिस्टम जो है इट विल ड्रेन इवेंचुअली इनटू द डीप वेनस सिस्टम. सो हियर वी ऑल्सो हैव परफोरेटिंग वेन्स ऑल्सो. सो यहाँ पे जो है ना वी हैव valves. ओके, दिस valves will prevent the backflow of the blood. So when these valves become incompetent, what happens? The blood will start clogging here in the superficial veins. All right, this engorged superficial veins due to incompetence of the valves results in a condition called as varicose veins. All right, so this was about the venous system of the lower limb. I think I have covered the entire thing. I have even covered the arterial system and the nerve supply also. So thank you. I've completed thigh here. In the next class, we'll be starting with the leg portion and then foot. Okay.